أعوذ بالله من الشيطان الرجيم. بسم الله. محمد بن عبد الله وعلى آله وصحبه. File of radiology consists of all the slides, the important slide in the whole lecture. 15, there are 15 lecture. I selected some slides from each lecture, about 90 something slides. Inshallah, we are going to discuss them. 20 of them, inshallah, will be in your Ospe exam next Monday. First lecture, section to diagnostic imaging modality, about 3 or 4 slides. First one, before starting, please try to share me and to talk, to know the the weakest point, and to try, and inshallah we are try to solve your problem. Please, especially in the beginning of the tutorial. At the end, inshallah, after we know which point is need more discussion and explanation, no need for participation, but please try to participate in the first slide especially. This slide gives the name of the imaging modality.
Nuclear medicine.
Radionuclide.
Yes, or radionuclide or nuclear scintigraphy. And the imaging examination is what? Imaging examination instead of modality. Like to explain this, لما نقول imaging examination, we mean the modality and the examined part. يعني مثلا this one radionuclide bone scan. The modality done for which part? For the bone. So this is radionuclide bone scan. Imaging modality, the technology only. The imaging examination includes the modality and the examined part. مثلا X-ray for the chest X-ray. This is the examination. But the modality is the plain X-ray or conventional X-ray without the examined part. So this is radionuclide bone scan. How to describe the abnormal area?
There is increase in the uptake.
Increase uptake.
There is increased uptake. Give one cause for this abnormality. What are the causes or differential diagnosis? Yeah, differential diagnosis and the causes of increased uptake in general. Not in this case.
Tumors.
Tumor, benign or malignant, yes. Maybe fracture, maybe secondary bone tumor, maybe Bugged disease, maybe bone infection. All this may cause, increased uptake. This is a patient, a woman present with palpable breast mass and nipple discharge. What is the imaging modality? AD. What is this exam?
Is it X-ray?
It's X-ray. X-ray for which? For the breast, يعني. Patient present with palpable.
Mammogram. Yes.
Mammogram. This is a mammogram or mammography. This is mammogram. هو طبعا بتتعامل بالماموجرام هو use X-ray لكن this is called mammography. X-ray of the breast called mammogram or mammography. And there are many views in craniocaudal and mediolateral oblique. This is additional view يسموه magnification view يعني to magnify the abnormality. What is the abnormality within the circle? What is the abnormality you see around within the circle? Or ايش within the circle the abnormality? Yes, this is the view.
Irregular.
Yes. What?
Irregular.
Irregular what? Do you see this؟ يعني هي دي عملنا magnification يعني هنا this is normal view. This is after magnification. What do you see? What are these?
Masses.
What are these spots? Do you see
Micro
this?
calcification.
Yes, this is a micro calcification. Calcification ده أي تكنيك بنستخدم فوق إكس راي ماموجرافي فلوروسكوبي بلين إكس راي سي تي. calcification دايما الدير أبيض وايت. طبعا بنقول on the X-ray or mammography بنسميه opacity. فعندنا micro calcification. ليش سميناه micro؟ لأنه very small calcification. This is the micro calcification. الأشياء البيضاء دي كلها micro calcification. What is the most probable diagnosis? قلنا المايكرو calcification associated raising the possibility of what?
breast cancer.
Yes, cancer, breast cancer, carcinoma of the breast. لما نبقى micro calcification, this is raise the possibility of the carcinoma of the breast. لكن لما تكون large calcification دي بتكون goes with benign breast tumor يعني fibroadenoma and others. But micro calcification commonly associated with malignancy. So this is the mammogram, microcalcification. The most probable diagnosis is CA breast. Also, this is other patient present with palpable breast mass or breast pain or nipple discharge. يعني لازم نديك symptom related to the breast. يعني ممكن نقول لك palpable breast mass or breast pain or nipple discharge or alteration of the nipple skin color. Here any symptom related to the breast to give you hint in this is the breast. What is the imaging modality or imaging technique or imaging
Mammography.
mammogram? Describe the lesion shown in this mammogram or this image.
Well-defined.
Well-defined,
Irregular.
irregular, speculative. يعني speculative.
Speculated masses.
Speculative margin. Well-defined, irregular with speculative margin. Speculative margin. What is the most likely diagnosis?
Breast cancer.
Breast cancer. إذا عرفنا البريست كانسر الساين بتاعته اللي هي دي well-defined, irregular with speculative borders and microcalcification. Also, this is the sign of malignancy. What is the imaging technique or imaging technique or imaging study? This one.
CT scan.
CT لكن
CT.
ايش؟ for what?
Angiogram.
for the blood vessels عشان كده سميناها CT angiogram لأنه demonstrates the blood vessels. So see this is CT angiogram لكن this is 3D. This is not 2D. This is 3D. 3D CT angiogram. What striking abnormality do you see? شايف ايه الابنورماليتي اللي شايفها؟
Dilatations of the artery.
What artery or which artery is dilated? You are right.
Abdominal aorta.
At which level? Abdominal aorta. يعني exactly at the level of before or after bifurcation. يعني just after before bifurcation or at the level of يعني عشان تعرف انكم انتوا you mean this
Yes.
Yes, but so this is a abnormal dilated aortic abdominal aorta. فديس is aneurysmal dilatation of the abdominal aorta. Normally المفروض تكون زي كده يعني، لكن هنا there is a aneurysm aortic aneurysm. The next is, lecture, the imaging technique or imaging study. What is this? اللي بيجاوب على السؤال ده عنده نص درجة بس يكلمني بعد ذاك باسمه في الخاص إذا جاوب. What is this imaging technique؟ كلمني أنا هعطيه نص درجة.
Angiogram.
اسمه إيش التكنيك؟ هو أنجيوجرام لكن اسمه إيش؟ Yes you are right اسمه أنجيوجرام لكن إيش هو بالضبط؟ يعني عندنا أنجيوجرام تعبير with many techniques.
99 MTC دكتور،
إيش؟
اللي تبدأ ب 99 بعدين TC شيء زي كذا.
99 إيش ال 99 M ده بيستخدم للنيوكليوس انتجريتي. ده راديو تريسر or radio isotope or radio pharmaceutical.
دكتور أنجيوجرام دي سي اي
Yes. Yes.
دي اس اي
DSA. What is DSA? إيش عن DSA؟ What is DSA? What do you mean by DSA? By the way, you are right. What is this DSA?
Digital Subtraction and Geography.
This is
ديجيتال سبتراكشن اند جيوغرافي.
Yes, digital subtraction and geography. We are going to divide the mark between two first and second. Please contact me, inshallah. This is digital subtraction and geography for the اللي هو دي cerebral digital subtraction لأنه معمولة for cerebral arteries. Digital subtraction and geography. This is the digital subtraction and geography. What is the name of contrast used in this technique? What contrast? What type of contrast? Is it barium? الأبيض ده كله contrast within the blood vessel. This is the iodinated contrast media. This is iodinated contrast media. This is the group. لكن عندنا there are many names for this contrast. لكن بس have to تكتب إنه شنو؟ This is iodinated. اللي هو water soluble iodinated contrast media. Iodinated contrast media. What is this imaging examination? Like what is this? What do you see? What are these structures? What is this and what is this?
دكتور
Large
هذه double barium
Crystal.
for colon.
Yes. Yeah. So this is a large bowl. So this is double. We got double contrast barium enema. Double contrast enema. Double contrast enema. Double contrast enema. ليه قلنا double contrast؟
الآن في لونين black and white، واحدة air أظن وواحدة fluid.
Yes. واحدة air and the other is
باريوم.
barium or iodine. iodine يعني اللي هي واحد positive واحد negative. The only negative contrast is air. يعني البيشنت ده we inflate the air to the bowl and also we introduce a positive contrast. It could be barium يعني most commonly used is the barium, but sometimes we can use iodinated contrast media اللي هي water soluble contrast if the barium is contraindicated. لكن we use two types of contrast, positive and negative. But this is a double contrast enema. يقول contrast enema, in which we use two types of contrast, positive and negative. Negative is air, and the positive it could be barium or hydrogenated water soluble contrast medium. What is this example? This one. What is this image? يعني?
Chest X-ray.
Chest X-ray. And what is this? The other one is, what is this?
Radiogram.
Also chest X-ray. But in different view. ما هي دي chest X-ray and this also chest
lateral
X-ray.
view.
Yeah, this
Lateral
is the,
view.
this is the ايش؟ is this lateral دي بتكون ايش؟
AB.
يعني هي PA. إذا ما عرفت PA ولا A B ممكن تقول frontal. Frontal include both. يعني especially in the مثلا oral ولا الهندي وصية لكم أي X-ray إذا ما عرفت PA ولا AB يقول frontal. Frontal means include both PA and AB. This is PA chest X-ray and this is a lateral chest X-ray. Both are chest X-ray. طيب what is the most likely diagnosis and what abnormality do you see?
دكتور عندي سؤال.
Yes.
يعني مو لازم أحدد هل هي الجهة يمين في التصوير أو يسار أو أمامية أو خلفية، يكفيني أقول frontal and lateral.
Frontal and lateral. Yes. Quite.
شكرا يا دكتور.
دكتور هذه غالبا تكون lobar pneumonia.
Yes, lobar pneumonia. Which lobe is involved by this lobar pneumonia?
The inferior
lobe.
Right.
Lower
Right.
lobe.
Lower. Why right lower? How to justify your answer?
Lower.
Yes.
لأن في
Yes. لأن في إيش؟
دكتور ناسي أنا مصطلح إن لونه أبيض، ناسي هي أوبيك ولا أوباسيتي. المهم إنه في لون أبيض على اليمين.
Yes. لكن أنت قلت in the right lower lobe. هي opacity.
medial يا دكتور.
Right medial or right lower?
right medial.
Why right medial?
الرايت ميديال كامل فاضي في الصورة اللي على اليمين يا دكتور، والواضح في الصورة اللي على اليسار، والواضح يا دكتور في الصورة اللي على اليسار إن التأثير من التصوير جاي من ورا مو جاي من قدام.
لا احنا عندنا صايم معينة، عندنا appearance معينة we depend on it to know which lobe is affected by the pathology. يعني عارفين إن right lower عندها appearance معينة، right middle عندها appearance and left lower, and all lobe has its specific appearance on the chest X-ray. When it involves, yes. طيب.
تقصد دكتور تقصد الاير برونكوجرام؟
Air bronchogram is the sign of consolidation. Air bronchogram is the sign of consolidation. لكن احنا عرفت انتوا قلتوا رايت لور. مثلا حنجي نسألكم بعد شوية حنقول لكم which lobe. Yes.
Diaphragm. The lower lobe.
Yes. Yes. Diaphragm. What about the diaphragm?
إنه يكون كأنه مرتفع أو متصل. يكون يعني مرتفع diaphragm.
مرتفع ده اللي يكون في شيء pushing it from down مثلا صب.
لا يعني إنه يكون كأنهم بنفس اللون.
يس اللي هو بيسموه ايش؟ يس يو ار رايت كده وصلت طيب إذا مشينا للchest X-ray دي. Do you see the right hemidiaphragm or the right dome of diaphragm clearly from costoclinic angle to the cardioclinic angle? يعني all right hemidiaphragm, do you see it clearly, sharply in this one?
Yes.
الdiaphragm هو الخط ضيق اللي هو شنو interface between the two densities. الدنسيتي البيضاء والسوداء، الخط ضيق ده هو الdiaphragm. دي الdiaphragm. You can follow it if it is normal. You can follow it like this. يعني you can مثلا بتجيب قلم تباص. You can draw a line through the diaphragm. This is a normal diaphragm. Also on the other side, this is a normal diaphragm. You can follow the diaphragm in area in contact with the lung. عرفت النورمال؟ نجي للابنورمال. In this left side, the left hemidiaphragm is continuously not obliterated, sharply not obliterated, clear. But in the other side, at this area, you are not able to see diaphragm. ما معروف الديافراغم هنا ما مبين. ليش؟ Because this pathology, this is a consolidation, obliterate or causing a unsharpness of this diaphragm at this level. When there is a pathology, يعني tumor, consolidation, obliterating or causing unsharpness of the right hemidiaphragm, this is most likely to be involving the right lower lobe. يعني لما ما يكون مبين معك الديافراغم بالجهة اليمين كويس، معناته انت عندك في right lower lobe pathology. وضحت لكم دي؟ الآن هنا الرايت هيم ديافراغم ما مبينة في المنطقة دي بالذات، ما مبينة. يعني هو المفترض نورمال يكون أسود كده مع أبيض كده، الخط يكون واضح. لكن هناك هنا المنطقة دي مثلا not well defined or بسموها unclear or unsharp or obliterated، يعني ما مبينة. This indicates إنه there is a right lower lobe abnormality. Be tumor يعني means that pathology involving the right lower lobe. This will be confirmed the lateral. لو تتذكر قلنا لكم the normal appearance of the spine on the lateral.
Normally, it becomes darker when we go down.
Yes, thank you. It is, there is increased lucency or darker. It gets darker when we go down. This is normal. لكن الآن there is a reverse spine sign. يعني بقت هنا المنطقة dark more above and the opaque area is below. So this is the indicating there is a right lower lobe abnormality because this area becomes opaque instead of black. إذا عرفنا إنه how to know إنه this pathology or tumor or consolidation involving the right lower lobe. In there is opacity here in the right lung zone. لكن ما معروف اللوب in the right lower zone، لكن حتى الآن إحنا ما عرفنا. لكن you have to look to the diaphragm. The diaphragm is clearly well defined, smoothly well defined, sharp. So this pathology is not confined to the right lower lobe. لكن if you look to the right cardiac border, it's blurred, unsharp, unclear. ما بنعرف هنا العكس دي. right cardiac border هنا مبين تمام. عشان كده ما هي not in the right middle lobe. لكن in the right middle lobe the pathology obliterating the right cardiac border. right cardiac border الحين كان قلت لك ارسم عليه بالقلم ما حتعرفه فين، لانه this area is obliterated, unclear, unsharp. إذا the right middle lobe obliterating and causing unclear, unsharp right cardiac border. برضه بنعرف نعمل شنو lateral. You can look and see this is the area of the right middle lobe. لو متذكرين right middle lobe located inferior to the horizontal fissure. This is the horizontal fissure. الخطية the horizontal and anterior to oblique fissure. This is the oblique fissure. This is the right middle lobe. ياخد opacity دي مبينة تمام in the left and the lateral view. You understand this point or not?
Yes, thank you, Doctor. Clear.
طيب this is a opaque hemisoric. لما نقول opaque معناته انه one side of the thorax appear brighter than the normal other side. But this is opaque hemothorax. What are the differential diagnoses of opaque hemothorax? لما نلقى opaque hemithorax, what are the possibilities, or what are the causes, or what are the differential diagnoses?
Pneumonia.
Pneumonia, What else?
Within the lung.
Yes.
Pneumothorax.
Pneumothorax. Is pneumothorax causing opaque hemothorax?
Pleural effusion.
Pleural effusion, yes. What else? Atelectasis or lung collapse
lung collapse
and
pneumectomy.
pneumectomy. وفي طبعا الاجينيسيس برضه it could be agenesis that could be the cause. في أي واحدة من الكوزز دي causing increase opacity اللي هو بيسموها increase ossified hemithorax. ossified يعني بقت بيضاء. This is a normal. This is a normal المفروض يكون loosened like this. لكن this site becomes opaque hemithorax. opaque. طيب to differentiate between these causes احنا عندنا sign معينة depend on it. فأول حاجة you have to look to the mediastinum and trachea. Is it centralized or not? If the heart and the trachea and mediastinum in place or deviated to right or to the left. And look to the opacity. If there is air bronchogram اللي قال زميلكم قبل شوية مقصود بها ايش؟ إنه في شنو؟ lucency. خطوط سوداء within the opacity. خطوط سوداء. branching linear lucency within the شنو؟ the opacity. الخطوط هذه بيسموها air bronchogram. هل في ولا ما في؟ برضه نشوفها. ونشوف الأوباسيتي ونشوف اللانج فوليوم يعني the affected part يعني it gets small or increase the volume we get more in the volume. In this one there is opacity with air bronchogram. Do you see the air bronchogram?
Yes.
الخطوط السوداء دي يسموها air bronchogram اللي هي bronchus containing air within the opacity. الباك جراوند كله بيبقى ossified لكن في some air within the bronchus يسموها air bronchogram. And there is no deviation of the mediastinum and the heart. يعني the mediastinum and heart is their place. So there is opacity with air bronchogram without deviation of the mediastinum and the trachea. And with normal lung volume يعني lung volume يهم تبدأ من هنا لحد هنا. There is no decrease or increase lung volume. So this is a pneumonia. إذا pneumonia characterized by إذا كانت هي pneumonia involving the most of the lobe فبيكون لنا شنو؟ opaque hemothorax with without shifting of the mediastinum or the heart or the trachea and with the opacity with air bronchogram without loss of lung volume. Also, this is a opaque hemothorax. لما نلقى one side أبيض بنسميها opaque hemothorax. أول من البداية لازم تعرف إنه this is the term إنه بنسميها opaque hemothorax. بعدين نشوف which one is this. عرفنا النيمونيا. This is other cause. Also, there is a opacity opaque hemothorax. There is no air bronchogram. ما في الخطوط السوداء دي. There is no air bronchogram. The trachea and mediastinum shifted towards the area towards the pathology اللي هو بيسموها ipsilateral towards the affected side ipsilateral not contralateral يعني الديفيشن towards the ipsilateral يعني حصل كأنه حصل شنو pulling of the mediastinum towards the lesion. This is the ipsilateral deviation of the mediastinum without air bronchogram with decreased lung volume. يعني lung volume تقريبا لحد هنا and this is the bowel يعني decreased lung volume. But this is the most likely to be what?
lung collapse.
Yes, this is the lung collapse. So this is just X-ray. الفايندنج اللي قلناها opaque hemothorax without air bronchogram with reduced lung volume with mediastinum shift ipsilateral mediastinum shift shifting and this is the most likely to be lung collapse. What sign do you see in this? What is the name of the sign demonstrated in this image? sign دي
meniscus sign.
Yes, meniscus sign. Yes, this is a meniscus sign. طيب meniscus sign the sign of what؟ يعني in this image طبعا meniscus sign دي ممكن تلقوها في other pathology لكن in this chest X-ray this meniscus sign indicate what؟ إنه في إيش؟
pleural effusion.
Yes, the pleural effusion.
Pleural effusion.
The pleural effusion. What other sign of pleural effusion؟ pleural effusion ممكن تاني تكون كيف؟ غير المينيسكس sign. إذا كان عندنا small pleural effusion بتعمل لنا إيش؟ تعمل لنا obliteration of the شنو؟ obliteration or blunted. شنو؟ الأنجل دي اسمها إيش؟ أنجل.
Costophrenic angle. Costophrenic.
إذا عندنا هي costophrenic. إذا عندنا small pleural effusion بتعمل لنا blunted costophrenic angle يعني بدأت تلقى الشارب كده بتبقى blunted or obliterated. دي كان small volume accumulate in this تسمى dependent area. إذا meniscus sign إذا كان شنو يعني intermediate volume. إذا كان small volume دائما بتعمل لنا شنو blunted or obliterated شنو costophrenic angle. أما إذا كانت massive it can cause ossification of the hemispheric. إذا كانت كثيرة مرة تعمل لنا كل السايد بيكون ossified اللي هي one of the differential of شنو opaque hemispheric. What is the imaging examination of this imaging examination? AD, okay?
TT.
CT what? For what? CT brain, CT
Chest.
CT chest or CT thorax, CT chest or CT thorax. What abnormality do you see? The abnormality on the right or on the left?
In the right.
Right.
Yes. What is the abnormality? PH.
hypodense.
Hypodense. Yes, you are right. What is this hypodensity?
Air.
Air
Yes,
that
air.
is compressing
Yes.
the lung.
Yes. So what is the where is this air? By what is the layer of the lung? The lung is covered by which layer?
Pleura.
Pleura. How many layers of pleura? Pleura
2
consists
layers.
of two
Parietal
parts.
and visceral.
Yes, visceral and parietal. So where is this air?
In the middle of the pleura.
Yes. So بيسموها ايش؟ Between the two pleural layers.
Pneumothorax.
Pneumothorax اللي هي
Pleural
accumulation of
cavity.
air in the pleural cavity or pleural space. The space between the شنو؟ But the visceral pleura is adherent to the lung. فهي موجودة على اللنج هنا. أما the parietal pleura is adherent to the شنو chest wall. The air is accumulated between the visceral and parietal pleura. By definition, this is a pneumothorax. This is the air. زي ما قال hypodensity. The air within the pleural cavity. This is pneumothorax. What is this examination?
Chest X-ray.
Chest X-ray. What striking abnormality do you see? ايش الابنورماليتي اللي شايفينها؟ اذا متذكر اكس راي مثلا دي وعملت كومباريزون بدي what is the difference؟
في continuous diaphragm.
Yes, continuous air. Where is this air? Where do you see this air?
Enter the diaphragm.
Under the diaphragm. Where is it? Right or left?
Left.
يعني you mean this?
Yes.
What is this? This air is. Where is this air?
It's a stomach bubble.
Under
Yes.
the diaphragm.
Yes, this is the stomach. This is يعني this is a normal air within the stomach. The stomach. But there is abnormal air in other part where the air is seen in abnormal areas. Look to this area. What is this? What is this? مثلا هنا. What is this? Or what is this? ايه هي؟ What's the density here? ايش density? What about the density here? يعني is it black? Is it lucent? Is it what is the density? In this one, ايه دي؟ ايه دي كلها؟
يمكن فات.
Yes.
فات.
الفات دايما بيكون شنو؟ little black, little darker، يعني بيكون هو اسود خفيف كده، يعني مثلا كده. لكن this is a grayish. Grayish is the density of what?
soft tissue.
ايه؟ muscle.
muscle.
Yes, this is the muscle. And this is the muscle and this is the fat. تقريبا في الفات يعني بيكون little darker كده. طيب لاحظ انه the fat is appear شنو؟ beige كده، ولا الاير appear lucent، مثلا bone opaque, fat little darker. If you look here, you can see there is a lucency in subcutaneous fat. there is a شنو؟ lucency. الخطوط السوداء دي normally not seen in the others. normal يعني ما في هنا دي الاير. فعندنا air in the subcutaneous tissue. فدي subcutaneous emphysema اللي هي this lucency or flakiness in the soft tissue, in the muscle or in the subcutaneous tissue. كل الأسود دي بنسموه subcutaneous emphysema، يعني air in the subcutaneous tissue. طيب what is this examination?
ARCB.
ايش دي؟ ايش الصورة دي؟ ايش هي؟
An X-ray of the chest.
Chest X-ray, yes. What do you see? What abnormality do you see?
There
large
is the
heart.
air. There is air under the diaphragm.
Yes, free air under diaphragm. In which side? In both sides. لاحظت هنا فينا شنو؟
Bilateral.
Bilateral. Crescentic in shape. قلنا the free air under diaphragm بيكون الديسكريبشن بتاعه الابيرنس بتاعته with شنو crescentic in shape. لو رجعت لاي chest X-ray ما بتلقى الا الاير اوف ذا fundus of the stomach in the upright position. لكن below the diaphragm normally there is no air. الا بتلقى الاير بتاع الفندس of the stomach. this is normal. لكن there is a free air in the diaphragm with crescentic shape. So this is called what? What is this? The abnormality. نسميها ايه دي؟
Pneumoperitoneum.
Pneumoperitoneum. Give one cause of this abnormality. Could you do what?
Perforated duodenum.
Yes, perforated any vesicle,
Perforation
any cause of this or that perforation of the diverticulum or after laparotomy, or this may be the cause. So what is this examination? Examination يعني هي
CT pulmonary.
yes, CT is contrast or CT contrast enhanced CT. الميم CT معها contrast، يعني أعطينا contrast. عرفنا كيف في contrast. You can look to the blood vessels. There is a contrast. طبعا إذا كان ما في blood vessels البلاد بيكون شكله زي ده، الدنسيتي بتاعته زي ده فلويد دنسيتي، لكن هنا the contrast seen within the blood vessel. طيب what sign is demonstrated in this image؟ اللي هي indicated demarcated by the arrows. سموها ايش الساين دي؟
split fluorescence.
split fluorescence اللي هي characterized by thickening and enhancing بلورة. يعني البلورة دي حصل لها بقت more thicken and enhancing with contrast. فالجرين this is the visceral بلورة, the red one is the parietal بلورة. They become thicken and enhancing with contrast. الانهانسنج ما مبين لانه عم بنلاقي عليها الكلر، لكن اذا ما عندنا الكلر ده كان حتشوف انها بقت بيضاء. طيب what is the diagnosis؟
lung abscess.
Is it lung abscess? Split pleural
lung
sign
emphysema.
is there
emphysema.
طيب
emphysema.
in the lung abscess الشيب بتاع الكولكشن ده غالبا بيكون راوندي، لكن الزبايمة بيكون زي شنو؟ زي كونفكس اور لنتيكولار شيب. هي الساين دي مهمة لنا عشان نفرق بها بين شنو lung abscess and emphysema. In emphysema the collection appear as the lenticular shape اللي هو biconvex زي العدسة، يعني biconvex lenticular shape. لكن in the abscess it is rounded، بيكون rounded instead of lacy shape. But this don't miss this is very important slide. Now also this is هنمشي مع شوية أسرع. This is a CT. What is the diagnosis؟
pericardial effusion.
pericardial effusion.
Yes. عرفت كيف إنها this is pericardial effusion؟ You are right. لكن why is it pericardial effusion؟ إيه الأبنورماليتي ذات what abnormality that what are the findings supporting your diagnosis?
stars in pericardium.
Yes.
enlarged heart.
globular shape.
Pericardial effusion by definition إنه pericardial effusion بيكون فيه fluid effusion fluid. But this is a fluid surrounding the pericardium, the heart. فدي إذا رجعت لأي CT ما بتلقوا الفلويد around the heart. This is a fluid العام نبقى الستار دي fluid. لذلك دي اسمه pericardial effusion. There is شنو؟ In this slide there is a fluid surrounding the pericardium or the heart. فدي كلها fluid. This is a pericardial effusion fluid around the heart. إذا ما عندنا مثلا دي دي heart. الهارت هنا المفترض ما يكون فيه شنو؟ pericardial fluid يعني، لكن this is pericardial. Also this is CT with contrast أو ممكن نسميها CT angiogram. كله صحيح. اللي هي CT with contrast أو CT angiogram لما نكون عند مبين لنا blood vessels. This is CT with contrast or CT angiogram. What abnormality do you see? Yes. What is this? What is this blood vessel? Which vessel is
aorta.
aorta? Which part? Aorta of you many parts. Descending or descending.
Is it descending?
Yes, this is descending. Descending دائما يكون posterior. يعني near to the the vertebra، لأنه هو بيبدأ anteriorly وبيعمل arching running posteriorly, arching posteriorly. So this is descending aorta. Look to the descending aorta in this image. Is it normal?
No.
What abnormality do you see?
It's divided.
Yes, it is divided. يعني حصل له dissection. This is the flap. حصل dissection. حصل لنا يعني false lumen. حصل dissection in the inner layer. فحصل لنا scaling of the blood. عمل لنا false lumen. بيسموها dissection. This is aortic dissection. الخط الأسود ده اللي هو دي شنو الفلاب اللي هي الاريا اوف شنو تيرنج. حصل لنا تير in the lumen. فإذا هنا شنو aortic dissection. The technique is CT with contrast or CT angiography. The diagnosis is aortic dissection. Aortic dissection. Don't miss this examination on this slide. Also, what is the imaging technique or imaging study?
CT with contrast.
Yes, CT with contrast. أولا ممكن نقول إيش؟
Test.
سي تي تيست ويز كونتراست او سي تي. الاول ممكن نقول ايش لما قلنا لما يكون مبين ايش البلاد بازيكس ممكن نقول ايش
CT angiogram.
سي تي انجيوجرام. اي واحده من دي صحيح. طيب وات abnormality do you see? What is this?
Abdominal aorta.
which one which abdominal اللي هو زي thoracic. This is above at the level of this is in the chest. This is thoracic aorta. Which part? abdominal aorta ما بكون عنده two parts. بيكون one يعني in the center. This is at the level of the thorax. This is ascending and this is descending. This is ascending and descending. Thoracic aorta. And what is this?
Pulmonary artery.
Yes, the main pulmonary artery. And this?
Pulmonary.
Yes, and this is what? Yes,
And this is right pulmonary artery.
Right pulmonary artery, and this is
And this is left pulmonary
Yes.
artery.
Is it normal, this pulmonary artery? Pulmonary artery. يعني
No.
what abnormality do you see? فيها ايش؟
Embolism.
Embolus.
Yes, impulse. But there is impulse. There is a عرفناها كيف؟ إنه there is a filling defect. زي ما كررت لكم كم مرة filling defect يعني إيش؟ لما نعطي contrast يكون في area done taking the contrast or enhancing with contrast بنسميها filling defect. المنطقة دي لأن due to presence of impulse there is no contrast enhancing this area. لذلك بقت black not similar to the other enhancing region. المنطقة دي بيسموها filling. There is a filling defect due to presence of impulse. So this is C pulmonary embolism. طبعا دي من الامرجنسي عشان كده مهمة جدا وانا دايما بحب البلمونري embolism دي. This is pulmonary embolism CT angiogram or CT contrast. طيب this is chest X-ray frontal view. What are the findings do you see? Abnormal findings or radiological findings. ايش اللي شايفينه abnormal يعني؟ What about the heart? Is it normal?
Enlarged.
Heart is enlarged, yes. Like what other findings do you see? طيب perihilar المنطقة دي is it normal؟
Butterfly shape.
اللي هو في ايش؟ butterfly opacity or bat wing. المنطقة دي بقت بيضاء اللي هو يسموها perihilar. دي ما يسموه الهايلم. perihilar. يعني زي شنو سنترال not peripheral. المنطقة دي بدأت opaque. ممكن تمشي تشوف أي chest X-ray يعني البريهايلر دي ما بتكون opaque like this is the perihyalar region. لكن there is opacity in perihyalar or central opacity with features اللي هي تكون بتشبه الباترفلاي or bat wing. إذا عرفنا increased cardiac shadow with opacity with characteristic shape butterfly or bat wing, and also there is a thickening of the septal line اللي هي شنو يسموها curly V line. في خط horizontal خفيف هنا دي هي صعبة تشوفوها إلا تعملوا magnification of the image. في horizontal line thickening interlobular fissure. What is the diagnosis?
Pulmonary edema.
This is a pulmonary edema. إذا يكون يجيب لك الchest X-ray دي تقول لك mention one sign أي واحد من دول بالإضافة لإن شنو what is the diagnosis أو what is the شنو the shape of the opacity اللي هو تعرفوا إنها butterfly or bat wing. إذا one sign ممكن تذكر أي واحدة increase cardiac shadow. برضه في الupper lobe prominent vessels. الupper lobe دي بقت enlarged برضه اللي هي sign. prominent شنو upper lobe vessels بقت dilated more dilated. Please go and compare between this and the normal one. If this patient present with abdominal pain, abdominal distension, and absolute constipation, what sign do you see?
Coffee bean sign.
Coffee bean sign.
واضحة لكم تماما اللي هي زي الكوفي بين دي السنترال اريا ودي الاذر دي الليفت سايد ودي الرايت سايد يعني دي كأنها هذه دي الكوفي بين سايد. What is the diagnosis? What is the most likely diagnosis?
Sigmoid.
Sigmoid volvulus.
This is a CT with contrast. What describes the abnormality demarcated by the arrows?
Calcifications.
Where is this calcification?
In the pancreas.
Yes, the pancreas.
Pancreas.
What is the most likely diagnosis?
Pancreatitis.
Chronic pancreatitis.
Yes, chronic. لابد تقول chronic لأنه calcification is a feature of chronic pancreatitis. لكن acute pancreatitis does not characterize by calcification. عنده other feature. إذا chronic pancreatitis. This is a patient involved in road traffic accident, RTA, road traffic accident, or sustained to blunt abdominal trauma. And what abnormality is demonstrated in the given image?
Fracture spleen.
Yes, fracture spleen or shutter spleen or lacerated spleen. يعني spleen here ما عندنا. Spleen is smooth without any density. This is a normal spleen, but here there is a laceration or fracture in the spleen. So this is a fracture or lacerated spleen. This patient is present with dysphagia. What is this? What is the imaging technique or imaging examination?
Barium swallow.
Barium swallow. Dysphagia دي قلنا لك عشان تتذكر إنه the barium swallow. يعني what is this? إذا what is this part? What is this structure? ده إيش ده؟ هو ده إيش أصلا؟ Is it head?
Esophagus.
This is esophagus.
Esophagus.
What describes the abnormality? إيش اللي شايفينه؟
Irregular.
Yes, irregular إيش؟ Yes, you are irregular what?
Narrowing.
Yes, يعني أول شيء هو عندنا structure narrowing with irregular outline. يعني المنطقة دي ضيقة. This is a normal ليومين، لكن there is a irregular structure تضيق with irregular outline with shouldering. قلنا دي سميها shouldering. المنطقة دي with shouldering. So what is the most likely diagnosis?
Esophageal carcinoma.
Esophageal carcinoma.
This is a patient with history of hair ingestion. What is the imaging modality used in this image?
CT stomach.
CT for the stomach. And what is this condition called? Patient present with history of hair ingestion. You can see this is a hair of different density. This اللي هي الكونتراست مع الهير انها له حصل بيكون indigested. The stomach is distended by this indigested hair with contrast. This is called, this is a طيب Crohn's disease احنا عارفين انه عنده many signs. One of these signs is what the sign is demonstrated in this. This is a contrast examination اللي هي barium. This is a barium enema. What sign demonstrated in this one? ولا اقول لكم خلاص خلوها دي اتركوها. What is the imaging technique? Is this one? This is a نحن ماشيين بطيء نمشي لكم اسرع. طيب this is double contrast barium enema. Double contrast barium enema. طيب double contrast barium enema. And what are the signs that you see? لو لاحظتوا ان this is a normal large bowel لانه في شنو؟ في الهاوستريشن هاوسترا circulation. In the other side there is a loss of normal appearance اللي هو there is no haustration with narrowing and shortening and featureless colon. Featureless colon يعني الكولون المفروض يكون عنده الهاوستريشن السيركيوليشن دي، لكن this is a featureless colon with فده بسموها ايش؟ what is the diagnosis؟
ulcerative colitis.
اما شيء الساين بتاعتنا كان قلنا ساين ومنشن اوف ساين narrowing or shortening or featureless colon or loss no haustration. All this is a sign of the ulcerative colitis. Also this is a single contrast, not double contrast. ما في air in this one. There is no air. We give no air to this patient. لكن this is double contrast. This is a single contrast barium enema. أعطينا البيشنت ده contrast rectum without any added air, artificial air. Also there is a narrowing and shortening and featureless colon. Also this is a sign of ulcerative colitis. This is a child present with abdominal pain and and diarrhea containing mucus or jelly-like diarrhea. What sign do you see? ايش الساين دي؟
Target sign.
The target sign. So what is the diagnosis?
Gallbladder stone.
Gallbladder stone. Where is the gallbladder ذاته اليوم؟ لما كنا احنا gallbladder stone لازم يكون عندنا gallbladder حتى نشوف الستون within the gallbladder. لكن this is a bowel. This is a bowel. What is the diagnosis? Target sign, the sign of what? Patient presents with abdominal pain and hair and jelly stool This is intussusception. Target sign is the sign of intussusception اللي هي الساين target sign. يعني patient هنديك hint إنه patient يعني عنده clinical presentation of intussusception. This is شنو intussusception. This patient is known case of CA bronchus. CA bronchus. What abnormality do you see? عندنا multiple lesion مثلا دي واحدة and this other one and this is other one and this is other one, multiple rounded lesion of different sizes scattering both hepatic lobe left and right. تأتينا النوديولز الكثيرة دي of different sizes. واحدة كبيرة واحدة صغيرة. There is a multiple lesion. So what is the diagnosis?
liver metastasis.
أي كيس نكتب له إنه هو أكيد لما نكون عنده نون كيس أوف سي حاجة أكيد هيكون ميتاستاسيس يعني دي نحن نديه أنت عشان تعرف إنه this may be metastasis. This patient present with right hypochondrial pain and high grade fever and high total white blood cells. What abnormality do you see? طيب describe المنطقة دي الابنورمال دي الديسكريبشن بتاعها in CT terminology هنقول في ايش؟ لما اي
Hypodense.
Yes, hypodense.
Hypodense.
Yes. Oh, there is a
And the liver.
On the liver, the right lobe of the liver. Type with when you correlate between the clinical presentation and this finding. لاحظ انه this hypodense of fluid density. يعني density دي بتاعت fluid.
Abscess because it appears like fluid density.
Yes, the fluid density shows the hepatic or liver abscess. What is this imaging examination? إما نلقى اللي ده طوال نفكر في إيش لو بديك هنت إنه this is what هو ده إيش ده بوريك إنه الإكزامينيشن ده إيش ده كان ده اندسكوب معناته الإكزامينيشن ده إيش مهمة جدا الصورة دي ERCB اللي هي إيش stand for what E for what and R for what
endoscopic retrograde.
Yes. What else? What next? Endoscopic retrograde. C for what?
Colonoscopy.
Yes. Endoscopic retrograde cholangiopancreatography. What is this part? Idea.
Stone.
Where is the stone?
Yes, up. Both arrows. There are stones.
There are two stones. اللي هي بيسموها filling defect.
Filling
أي
defect.
منطقة أعطينا كونتراست وبقت ما أخذت الكونتراست اسمها filling defect. There is a stone. Where is this stones? موجودة وين؟ يعني structure ده شنو هو؟
In the common bile duct.
Common bile duct. This is common bile duct stones. This is common bile and this is the cystic duct stone. هنا برضه عندنا filling defect in the cystic duct. This is a cystic duct stone. إذا عندنا common bile duct and cystic duct stone and this is ERCB. What is this? إيش دي التكنيك دي؟
ultrasound.
What abnormality do you see? طيب قبل شوية في زميلتكم قالت إنه كان قالت دي شنو؟ جول بلادر. يمكن احتمال تكون شكت في المنطقة دي إنه زي جول بلادر. جول بلادر.
Hyperechoic.
So there is a stone in the gallbladder. It appears hyperechoic.
Yes, hyperechoic with أهم شيء دي with what?
With the shadows.
Shadow.
Right, posterior acoustic schedule. أي stone anywhere بيكون hyperechoic with posterior acoustic schedule or dorsal schedule, posterior acoustic schedule. This is gallbladder stone. طيب this is a nuclear scintigraphy or radiolyte bone scan. This patient is known case of CA breast. What abnormality do you see?
Increase the uptake.
Yes, but there is a multiple areas of increase uptake, يعني multiple areas. So what is the diagnosis? قلنا البيشنت سي بريست، انا اقول لك سي بريست، طوال تعرف انه كارسينوما في بريست
Metastasis.
ميتاستاسيس. اذا ما كان قلنا سي بريست ممكن كان نقول لك give one cause of this abnormality، ممكن تذكر اي واحد، ميتاستاسيس، اسمه شنو الفراكشرز، اي واحده من الكوز اوف انكريز ابتيك. لكن كتبنا لك سي بريست so diagnosed most likely انه يكون شنو ميتاستاسيس. This is X-ray. What do you see? ايش شايفين؟
Fracture of the radius with anterior
Yes,
displacement.
yes, the radius. What is the name of this fracture?
Fracture.
Smith.
ليش Smith fracture? Smith fracture characterized by شنو زي ما انت قلت distal radius fracture and what else؟ لابد يكون في
Anterior displacement
yes,
and angulation.
yes, anterior angulation. In contrast, this is a what is this?
Colles fracture.
Yes. Colles fracture characterized by
Posterior displacement and
هيكون نفس اللي fracture in the distal radius، لكن بس الانجوليشن زي ما قلت انت posterior dislocation. لاحظ الانجل دي this is posterior اللي هو dorsal angulation of the distal fragment. الانجل دي posterior. What sign do you see؟ اسمه تيري توماس 2 sign. هو ده تقريبا ممثل ولا كذا، عنده absent one piece، فthis is يعني كأنه سموها تيري توماس 2 sign. فكأنه عنده الابسنت بيس دي يعني المنطقة بتاعت فراغ فسموها عليه كده تيري توماس بيس. So what is the diagnosis? What is this bone?
Scapuloid.
And what is this?
Capital.
And what is this?
Lunate.
Lunate. The distance between scaphoid and lunate.
Dislocation.
Yes, it's dislocated. Scapholunate dislocation. And normally the distance between the scaphoid and lunate is less than this. Like there is a gap. There is a gap between the scaphoid and lunate. So there is a dislocation. Scapholunate dislocation. The sign is Terry Thomas sign. How to classify this fracture according to the Salter-Harris classification? Which type is this?
Type 2 because
Why type 2?
Because including metaphysis and physis.
Yes. What is this Salter-Harris type?
Type 3 because it's epiphysis and physis.
Yes, it includes the epiphysis and physial blade, but the metaphysis is normal. There is no fracture. This type?
Type 4.
Type 4, as it involves all metaphysis, physial blade.
Metaphysis.
What sign do you see or appearance or sign? This patient present after electric shock or epileptic seizure.
Light bulb appearance.
Light bulb.
زي يبقى لنا اللمبة بتاعت النادي اللايت bulb اللي مدورة دي. This is a light bulb sign. So what is the diagnosis?
Posterior dislocation. The shoulder.
Where what abnormality do you see?
Fracture of the neck.
Neck of the humerus. طيب, where is the fracture here? هنا في fracture. What is the, where is the fracture here?
In the femoral neck.
In the femoral neck. لكن بيسموه شنو دي؟ impacted. يعني حصل fracture وحصل له impaction. فدي impacted fracture. حتى ال two part impacted in each other. فدي is impact. لكن fracture site in the neck of the femur. Is this fracture in the neck of the femur? And where is the fracture here? Is it in the neck also? It is not. It is running from here to here. بيسموه ايش؟ What is this? هي ايش؟ lesser and greater trochanter. This is intertrochanteric fracture. لابد انا طالما اجيب لكم واحده من دي. فاذا هي this is a fracture neck of the femur and this is a intertrochanteric fracture. The fracture fidia running between the lesser and greater trochanter. In this one, this is the intertrochanteric fracture. And this is the fracture neck of the femur اللي هو هنا في المنطقة دي. الآن هي normal دي، لكن هنا في fracture impacted fracture. يبقى this is a rickets. طبعا rickets الساين بتاعته تكون حافظينها. يعني ممكن أقول لك mention one or هنا اللي هي شنو fraying and cupping of the metaphysis with irregular cupping. But this is a you know rickets. But this is a rickets. Metaphyseal margin is cupped and irregular with widening of the epiphyseal blade. Epiphyseal blade is widening. But this is a you know rickets. This patient presents with a history of repeated blood transfusion. What sign do you see?
hair on end.
Hair on end appearance. اللي هي differential diagnosis عندها many differential diagnosis. حتى even the sickle cell anemia can cause this and also thalassemia and others. Mention one the cause of this appearance is you can write thalassemia or sickle cell anemia. The common one is thalassemia. Hair on end appearance. طيب what striking abnormality do you see? أكثر حاجة مبينة في الإكس راي دي شنو؟
bone density.
Increase bone density.
مالها increase. Is it focal or
generalized?
Generalized. What is the يعني what give one cause of this appearance?
Osteoporosis.
Osteoporosis. اللي هو عنده other name بيقولوا يسموها شنو marble disease. Osteoporosis or marble disease. This is a rheumatoid arthritis. خلوها طيب. What is the appearance of the spine? This appearance of the spine is called what?
Bamboo spine.
Bamboo spine. And this one?
والجيرسي سباين.
جيرسي سباين. الجيرسي سباين اللي هو الشيب اللي قلنا بتاعين الركبي دي ولا شنو؟ يكون فيه مخطط كده اسود ابيض. This is the alteration between the densities. Loosen, opaque, loosen, opaque, loosen, opaque, loosen, opaque. This is Jersey spine. And this is the you know, bamboo spine. Bamboo spine. طبعا both are X-rays. Imaging modality is X-ray. What's the real name of this spine? Osteoarthritis. What abnormality do you see? ايش الابنورمال؟ Which bone is abnormal? Compare between the carpal bone. Which one?
Decrease في densities of unit.
اليونيت ايش؟ اليونيت مالهم؟
Decrease في density.
Decrease or increase? Decrease معناته بيبقى بلاك. وصل الفون ده بكون برايت، لكن this there is شنو؟ Compared to the normal others, the density of this مالها
Increase.
increase، يعني بقت more bright. There is increased density. إذا كان decrease بتبقى black. لو تذكروا كانت أخذنا الليتيك ليجن focal decrease bone density lytic، لكن this is the sclerosis أو شنو opacity more sclerotic or more opaque. فدير حتى دي قلنا increase generalize increase، أي حاجة تبقى بيضاء مرة بنسميها increase bone density، لكن هنا there is increase compared to the other. فدير is this is a vascular necrosis. A vascular necrosis of these bones leonate. طيب what is the mention the or enumerate the sign, the manifestation, radiolator manifestation in this X-ray. How to describe this abnormality يعني. Yes, sclerotic. This lesion also sclerotic. This one. الدنسيتي بتاعتها زادت ولا قلت compared to the other normal؟
قلت.
بنقول ايش؟ اذا كان
hypo
hypodens for the CT.
hypo opacity. Decrease the opacity.
Decrease bone density نسميها قلنا ايش؟ decrease bone density نسميها lytic areas or lytic lesion. تكلمنا عنها في الام اس كي، قلنا انه if there is a focal reduction in bone density نسميها lytic areas or lytic lesion. فthere is a expansile lytic lesion eccentric located، يعني not in the center، يعني eccentric in the located in the metaphysis، يعني in the يعني هي subarticular in the metaphysis. expansile أهم شيء كلمة expansile دي كانت تحسبها dilated الليجن دي. lytic lesion lytic black expansile. Is this adult or child bone?
Adult.
Why?
Because the epiphyseal plate is fused,
yes,
closed.
That is closed. So when there is a lytic lesion expansile in the metaphysis subarticular eccentrically located, this is a characteristic feature of giant cell tumor. أهم شيء تتأكد إنه this is cross plate is closed. لأنه عندنا other lesion حنيجي نتكلم عنها بنفس الفيشر دي تقريبا، بس عندنا الابيثيزيال بليت بتكون ستيل اوبن، يعني كايل بتكون فديه بتكون لنا مع انها نفس قريبه للفيشر دي. الدايجنوز بتاعها بيكون انيوريزمال بونسيس. فالان تكلمنا عن الجاين سيلز، اذا جبنا دي الجاين سيل لانه الابيثيزيال بليت is closed. This is the patient present with open fracture. What abnormal do you see? History of open fracture and history of open fracture. What abnormal do you see? طيب what is this الارو ده point to what sign دي ايش اللي ده بنسميه ايش؟ is it normal الحاجة الدنسيتي او opacity دي is it normal؟
No.
Periosteal reaction.
Periosteal reaction. This is a periosteal reaction. This is a periosteal reaction. In a lytic lesion, lytic areas, destruction of the bone in this area with periosteal reaction in patient with a history of open fracture. So what is the most likely diagnosis?
Osteomyelitis.
يبقى this is a renal angiogram خديناها كلها تقريبا في البلاط نفس الكلام ده. But this is a catheter introduced into the renal artery. Into the renal artery. So this is a renal arteriogram. And this is a renal artery, and this is a kidney, and this is a catheter renal arteriogram. What is this image? idea.
Abdominal CT.
Abdominal CT.
طيب what abnormality do you see? برضه take care of this slide يعني. شايفين ايش abnormality. طيب what is this?
Liver.
Liver, yes. And what is this?
Kidney.
What's
kidney.
Right kidney. And this?
Kidney.
Left
Right
kidney.
طيب compare
Left
between
kidney.
right and left kidney.
اليوريتر عند الليفت كدني موجود بس الرايت كأنه مو موجود.
اليوريتر عند ايش؟ left or right kidney.
الرايت.
right صح مو مبين لكن الليفت مبين وماله لكن. طيب what is this?
Calculi.
This calculi. Where is this calculi?
Present in the left ureter.
So this is the left ureteric stone or calculi. لو لاحظتوا above the
dilated.
dilated. عندنا hydroureter and even hydronephrosis حتى الرينال بيلفيس dilated لأنه obstructed here فحصل شنو؟ dilatation or hydronephrosis of the anhydroureter. لكن الأذر ما في obstruction عشان كده اليوريتر ما مبين لأنه normal هو. لكن this is the left ureteric stone with hydroureter and hydronephrosis. In this CT of the abdomen with IV contrast. عرفنا ليش with IV contrast لاحظوا الكدني بقت شنو؟ فيها contrast الرينال cortex فيها contrast. What is this? idea.
Ultrasound of the kidney.
Yes. What do you see?
There is stone appears hyperechoic.
Yes. بتقول بقى hyperechoic في الستون دايما don't miss انه شنو؟
shadow.
الشادو ده ما تستنسوا الشادو. أي ستون بيكون hyperechoic is posterior shadowing اللي هو طوال تلاحظ ليه posterior left تلقى الشادوينج. This is hyperechoic. So this is the renal stone or kidney stone. There is no hydronephrosis. هنا ما في dilatation of the renal pelvis. لكن بس عندنا stone in the upper bowel kidney. Also this is CT demonstrates this stone. الستون دائما in CT بيكون hyperdense or of high attenuation. This is the left renal stone. This is CT without contrast. CT KUB or CT without contrast demonstrates stone. Also this is the stone in which, where is this stone?
In the bladder.
The bladder. This is cycle stone. stone أي مكان في الإكس راي بيكون شنو hyperechoic. لأن the ultrasound بيكون hyperechoic
with shadow.
طيب concerning this, what is this?
CT of the abdomen.
Which plane or which section يعني?
Coronal plane.
What abnormality you see?
Large kidneys, bilateral enlargement of the kidneys.
Yes, the kidneys bilaterally enlarged and bulky. And what else? أهم شيء مالها فيها إيش؟
multiple cysts.
فيها multiple cysts in both kidneys.
cysts of different sizes. يعني دي كبيرة دي small. They in the bulky kidneys with multiple cysts. النورمال tissue parenchyma البيضاء دي هي النورمال tissue parenchyma، لكن كل دي الأضل كله cysts different sizes scattering renal parenchyma with large and bulky kidneys bilaterally. So what is the diagnosis?
Polycystic kidneys.
Yes, autosomal dominant polycystic kidney. And also this is axial CT demonstrates the same feature لكن axial multiple cysts. طبعا إذا هناك تكون الكدني برضه bulky يعني large kidney with multiple cysts. المدورات دي كلهم السيك الليجن السيك اوفويد ليجن دي كلها شنو cyst. This is شنو autosomal dominant polycystic kidney. Also this is CT. What is this?
Left kidney.
Yeah, right. This is left kidney. Where is the right kidney?
The large.
Yes. So what is there is a mass.
Yes.
This is a normal. يعني الجزء ده بس البسيط ده هو النورمال renal parenchyma. لكن this is a huge mass. So this is a renal cell carcinoma. Renal cell carcinoma. What is this technique or this examination? technique.
Hysterosalpingograph.
Hysterosalpingograph. طيب in this one, what abnormality is demonstrated in this? نقول فيه ايش؟
It is dilated.
اللي هو بسماها ايش؟ dilated. which here dilated دي ايش؟ زي يطرس يعني؟
Blockage.
fallopian tubes.
fallopian tube هي dilated بنسميها ايش لما نكون dilated fallopian tubes؟ بنقول فيه ايش؟ هي dilated لكن في term نقول شنو؟ لما تكون fallopian tube dilated نقول
hydrosalpinx.
hydrosalpinx. There is a bilateral hydrosalpinx اللي هي due to شنو blockage زي ما قلت blockage in the distal part. There is no spill. القطراس ما تدفق. There is a blockage in the distal part, so there is a bilateral شنو hydrosalpinx. And also here there is bilateral blockage with هنا في hydrosalpinx لكن هنا ما حصل لنا hydrosalpinx. يعني ما minimal dilated fallopian tube لكن this is a massive dilated fallopian tube hydrosalpinx. Like this patient present with abnormal hair distribution, hair shape, and history of infertility. What is the imaging technique? What is this? عملنا لها ايش فيها او عملنا لها ايش؟ This is a female patient.
Ultrasound.
Ultrasound. What describes the abnormality? What do
Multiple
you see?
cysts in the ovary.
Yes, there is a multiple follicular cyst with أهم شيء برضو الأوفريز مالها bulky, enlarged,
Increased size of the ovaries.
And the distribution of these follicles or small cysts distributed in which area?
periphery.
Periphery. This is a polycystic ovary syndrome. Is an ultrasound اللي هي transvaginal كمان transvaginal ultrasound اللي هي أهم شيء شنو features enlarged or bulky ovary with multiple cysts distributed in the periphery of the ovary, polycystic ovarian syndrome. And what is this? What abnormality do you see? ايش ده لما نلقى شيء زي ده معناته في ايش؟ هل هي ده شنو موجود ده ايش؟ How to describe this abnormality?
Teeth appearance.
Yes, appearance. هي calcification في البداية وهي calcification of شنو؟ teeth appearance. So what is the diagnosis?
Dermoid cyst.
Dermoid cyst. Calcification with characteristic teeth appearance, but this is dermoid cyst. This patient present with enlarged scrotum. What is the imaging technique? عملنا ليش؟
Ultrasound.
And what abnormality do you see?
fluid surrounding the scrotum.
اللي هو بنسميه ايش؟ fluid surrounding the testes.
Hydrocele.
This is the hydrocele. طيب this patient present with a history of infertility. And testicular atrophy. What is the imaging modality اللي استخدمنا ايش؟ X-ray, CT,
Ultrasound.
this is ultrasound. طيب what is this؟ قبل دي طيب what is this؟
testes.
Yes, we have testes and this is the other testes. And what is this?
Bambiform plexus.
This bambiform plexus. Is it normal?
Dilated.
هنا عملنا ايش؟ في الاذر سايد دي. ده بنسموه لما نحط البوكس ده قلنا البوكس ده بنسميه شنو؟
Colored Doppler ultrasound.
لذلك عملت ظهر لنا الكلر فلو. لاحظ انه معناتها دي blood vessels dilated bambiform plexus. But this is what is the diagnosis?
Varicocele.
Also, this should be put in your mind. Imaging present with testicular adrenal infertility. What is the imaging modality? Is ultrasound of the scrotum. Imaging technique or imaging study ultrasound the scrotum. What is the diagnosis? Is varicocele. Like also, this is ultrasound. What is this? Patient present with scrotal pain and swelling. What is this? Okay. Patient present with scrotal pain and swelling. Can you put scrotal pain and swelling? Yes, this is testis. And what is this?
Epididymis.
Is the testis normal or not?
Yes, normal.
But what about the epididymis?
Increased vascularity.
So what is the diagnosis? Epididymitis, yes. And also this is other patient present with scrotal pain and swelling. What abnormality do you see?
Increase the vascularity in the testes.
In which structure?
In the testes.
In the testes. So what is the diagnosis?
Orchitis.
Last ما قلنا epididymitis. قلنا orchitis means the vascularity is increasing in the testes only. And also this other patient present with scrotal pain and swelling. What abnormality do you see? What is this?
Testes.
And also this is testes. Compare between the two testes. Concerning the color flow. Is it symmetrically or there is a variation or difference?
Decreased vascularity in the abnormal.
Yes, in which one? Is this one or on the other one?
The right one.
The right one. There is a decreased vascularity. يعني هي slight يعني لاحظ إن هي في more vascularity هنا less or يعني reduce. شنو vascularity is this So what is the diagnosis? Patient present with scrotal pain and swelling.
testicular torsion.
Yes, testicular torsion. Testicular torsion. Testicular torsion. طيب دي برضه. طيب concerning the contrast, what are the pattern of a contrast enhancement؟ لما نعطي البيشنت for the CT head CT with contrast، عملنا CT with contrast أو enhanced CT with for the head. What are the possibilities or the pattern of enhancement اللي قلناها؟ في عندنا pattern of enhancement. It could be what or what or what. الطريقة بتاعت الليجن
Anyways.
homogeneous or yes, homogeneous or other pattern.
Ring.
Serpiginous, yes, or homogeneous or heterogeneous or ده بنسميه زي ده. لما contrast enhancing the lesion بيسموه ايش الباترن ده؟ ring or peripheral يعني ring, and this is a serpiginous and this is a homogeneous ما فيها heterogeneous. فهنتكلم عن الثلاثة دي. طيب what is the cause of serpiginous enhancement؟ عندنا only one cause. ايش؟
Aneurysm.
serpiginous.
Arteriovenous malformation.
Arteriovenous malformation. What are the differential diagnosis of this pattern؟ تلقينا زي دي. Abscess, yes, what else? Metastasis. Tuberculoma. كيلايوما. طبعا في أذر لينفوما وفي يعني في أذر، لكن تعرفوا الأفكار ديل اللي تكلمت عنهم ديل. طيب this is what is this pattern of enhancement؟ homogeneous. What are the differential diagnosis of homogeneous؟ on the top دائما أول واحدة بنقول إيش؟ meningioma. What there is other مثلا aneurysm. طبعا هنا زي ما قلت لكم في اذر برضه، لكن تعرفوا الاربعه دي. This is called pattern enhancement. طيب what is this the imaging technique؟
MRI of the
What
brain.
abnormality is demonstrated in this MRI؟
Absence of the corpus callosum.
Yes, absent corpus callosum. This MRI which sequence؟ ايش يعني sequence؟
T1.
Yes, so this is a T1 because the CSF is black or hypo intense. طيب this is what is this؟ ايش ده؟ What is this structure؟
Corpus callosum.
هنا absent. There is no corpus callosum.
Absent.
Yes. Callosum. This one there is agenesis. Absence of corpus callosum. This is MRI T1 with contrast. T1 sagittal. What abnormal? Identify the name of the what the abnormality is demonstrated in this image. PH. What is the diagnosis?
Pituitary macroadenoma.
Pituitary macroadenoma. There is a mass in the pituitary region which is more than 10 millimeter اللي هي macroadenoma. طيب what is the imaging technique or imaging examination؟ This one, what is this؟ ايش هي؟
CT.
CT with or without contrast.
with contrast.
دي نفس البيشنت.
A is without contrast and B is with contrast.
D is with and this is without. لكن لو لاحظتوا فعلا الليجن دي هي يعني فيها شنو؟ density. Why this appear hyperdense like this؟ معناتها فيها ايش؟
Classification.
فيها calcification. Thank you. So to describe this lesion لاحظ انه there is a round lesion with broad base with calcification. دي بنسميها ايش المنطقة دي اللي حوالين الليجن دي؟ what is this؟ المنطقة السوداء دي بنسميها ايه دي؟ دي ايش؟ what is the cause of this hypodensity؟ هل calcification also؟ around the lesion بيكون في ايش؟ edema. This is a perifocal edema.
Fluid.
Fluid edema. Yes. After the contrast, the better of enhancement is
hyperdense.
Better of enhancement.
Enhancement. Homogeneous enhancement.
Homogeneous.
Yes. Better of enhancement is assessment. Is it serpiginous? This better of enhancement is homogeneous enhancement. This is MRI T1 with contrast. Also لاحظ انه زي ده homogeneous enhancement وقلنا دي بنسميها tail. إذا شنو؟ dural tail اللي هي دايما بتشوفها مع المننجيوما. Also there is a massive effect. لاحظ انه there is شنو؟ massive effect compression of the lateral ventricle and midline sheath بنسميها massive effect. This is شنو؟ مننجيوما. أهم شيء البتر في enhancement برضه homogeneous. What is the better of enhancement in this image؟ ring enhancement. قلنا ايش دي؟ This is a lesion with ring enhancement. Around the lesion دي ايش؟ المنطقة السوداء دي في ايش معناتها؟ perifocal brain edema. This is brain edema.
Maybe fluid.
This fluid اللي هي edema يعني brain edema. edema.
Okay.
brain edema. As the differential diagnosis طبعا إذا قلنا لك الهيستوري ممكن خلاص ما حنديكم الهيستوري، لازم نقول لك mention any one cause of this better enhancement. تكونوا عارفين أي واحدة من الفور دي. Also this is a you can see this is T1 with contrast MRI. أيضا زي شنو peripheral enhancement. لاحظ السنتر بيكون شنو بلاك لكن ال contrast enhancing the periphery of the lesion. Also this is شنو multiple ring enhancing lesion. multiple ring enhancing. لاحظ إنه هي الانهانسمنت in the periphery. But this is also could be due to الديفرنشال دياجنوز اللي اتكلمنا عنه. اهم شيء البتر في enhancement is ring enhancing. Also this is a ring enhancing lesion. ring solitary one lesion. اهم شيء زي ما قلنا البتر في enhancement. طيب what is the imaging modality؟ ايش دي؟
MRI CT.
CT. زي ما كررت لكم دائما قبل ما تقول MRI CT تشوف الايميجنج ستراكشر، تشوف البون element. يعني مثلا زي سكال هتشوف الكالفيريال بون، اذا لقيته ابيض مره ابيض ناصع على البياض تقول انه CT. اذا كان جريش ولا يعني داركر فكر في MRI. فدي is CT head or CT brain without contrast. What is the diagnosis؟ hydrocephalus. طيب what sign is demonstrated in this image؟
The ventricles are dilated.
sign في sign اسم sign صح. الventricle dilated. which is طيب which ventricle is dilated؟ What is this? What is this ventricle? ايش the name of this ventricle؟ ايش؟ يعني this is the fifth ventricle. Yes. ده أي ventricle ده؟ طيب what is
lateral ventricle.
yes lateral. Which part of the lateral? اللاترال عنده many parts. This is anterior or frontal. يعني نقول anterior or frontal شنو horns. Anterior or frontal horn. This is the left one and this is the right. يعني this is the left horn of anterior or frontal the lateral ventricle, and this is the right frontal horn of lateral ventricle. And what is this? What is this ventricle? What is the ventricle? Which one? In the midline. This is third ventricle. This is third ventricle. And what is this?
Third.
The temporal horns of lateral ventricle. Lateral horn, lateral ventricle عنده anterior and posterior and شنو temporal horn. عنده body. This is anterior horn or frontal horn. إذا البوستيريور بيظهر هنا في other section. And this is temporal horn. For all these ventricles are dilated. قلنا الساين دي بيسموها ايش لما تلقى الفرونتال هورن مع السير ventricle dilated؟ بيسموها بتشبه ايش؟ بتشبه لنا ايش؟
ميكي ماوس.
Mickey Mouse, yes, exactly. طيب describe the what is the imaging modality? What is this?
MRI of the brain.
Of the brain, yes.
T2.
Coronal sagittal axial.
Axial.
طيب what findings or what signs are demonstrated in this MRI?
Prominence of ventricles.
Yes, the ventricles are the lateral ventricles and body. This is a body, and this is an anterior horn, and this is a posterior horn are dilated. And what else?
Dilation of the cerebral sulci.
Yes, cerebral sulci also are dilated. تعرف إنه فيها CSF كتير دي. Also there is a cerebral sulci dilatation. So what is the diagnosis?
Cerebral atrophy.
لذلك لازم تدققوا كويس إذا لقيت اللاترال فنتريكل ممكن تكون دايليتد أو الفنتريكل دايليتد والسلساي نورمال، تعرف إنه this is hydrocephalus. لكن إذا كان الفنتريكل دايليتد ومعها السلساي دايليتد طبعا بيكون في اتروفي اوف ذا جايرس معاها او البرين تيشو يعرفون اتروفايد، فدي بتكون شنو ديو تو سيريبرال اتروفي. إذا لما تلقى دائما الفنتريكل دايليتد you have to look to the cell side. Is it dilated also or not؟ إذا كانت not تفكر إنه is the hydrocephalus، لكن إذا كانت cell side dilated فدي تفكر إنه this is age related especially if the patient is elderly. طيب how to describe this abnormality؟ نقول الvertebral body دي مالها according to the appearance مالها هي what abnormality؟
Increased density.
Yes, increased density. But this is there is increased density, and also there is increased density in this one, and compared to the other, يعني. And also this one is decreased, يعني this and this one, both this and this are increased in density compared to the normal others. اللي هي دي normal, لكن this is increased density and also this is increased. There is increased density of this vertebral body compared to the other. هنا دي more dense. لكن دي طبعا انا مبينه شديد، لكن also this and this compared to the other normal. So this is a differential diagnosis of increased density vertebral body density. فعندنا many causes. لذلك احنا لما اذا جبنا لك اكيد حنجيب لك واحده من ديل لازم يو هاف تو لوك تو ذا هيستوري. فمثلا زي دي ممكن اقول لك انه البيشنت نون كيس اوف كارسينوما اوف ذا بريست. So
metastasis from the
Metastasis.
carcinoma
metastasis.
of the breast.
abnormality زي ما انت قلت شنو increase density is vertebral body density. طيب زي دي ما ممكن ما نعطيك هيستوري بس نقول لك what is the give one sign, give one radiological manifestation of the vertebral marked by the arrows. طبعا ممكن تذكر انه increase density لكن في اظرف اللي هي ايش؟ غير ال increase density.
enlarged.
enlarged يعني لاحظوا vertebral body دي enlarged compared to the other. enlarged with the trabeculation pattern is thick and irregular. الخطوط دي هي trabecular اللي هي شنو؟ wider and irregular. And also in this one the arrow vertebrae يعني هي increase in density and also there is what?
Vertical striation.
vertical striation of يعني لاحظوا trabecular لاحظتوا الخطوط ال vertically oriented دي. So what is the diagnosis here?
Hemangioma.
Hemangioma. And what is the diagnosis here? Increased density with enlarged Paget disease. And what is the diagnosis here? Increased density with history of
Metastasis of breast carcinoma.
what is this exam or this study? Plain X-ray.
MRI.
MRI.
T1 or T2?
T2.
Of which part? MRI of what? For the ankle, for the head.
The back is fine.
Of the neck.
Ankle is fine. T2. Which plane or section?
Sagittal plane.
Sagittal.
This patient presents with the symptoms of cervical myelopathy. قلنا لما نقول myelopathy معناته إنه في symptoms related to the spinal cord compression. What abnormality do you see?
Disc herniation.
Yes. At which level?
Cervical.
يعني at which level? Vertebral level. At which level?
C5 C6.
Yes. طبعا دي this is 1 2 3 4 fifths and this is 6 between 5 fifths and 6. This is the herniated or disc herniated disc. أيضا دي الصورة يدخلوا لها بقى the herniated disc at the level of C5 C6 in this MRI cervical T2. Also this is MRI T2 demonstrates this lesion. Here what is this? Abnormality. Syringomyelia اللي هي شنو؟ Circular collection of CSF within the spinal cord. The spinal cord بيحصل لنا شنو؟ Collection of the CSF within the spinal cord. Syringomyelia. In this single. This is a young woman. طيب دي خلوها برضه. Ignore this one. Young adult women with optic neuritis. What abnormality do you see? طيب this is MRI T1 or T2?
T2.
As in CSF price يعني كده T2. There is a lesion here. This lesion is ill-defined, elongated. يعني كأنه oval, elongated with ill-defined margin. يعني ما حتى ما قادرين نعرف المارجن بتاعتها. This is شنو؟ MS multiple sclerosis. Multiple sclerosis بتكون دايما elongated, ill-defined. Ill-defined, elongated lesion. طبعا دي من الاشياء المهمه جدا الليكشر بتاعت السي تي. فدي what is this? What is the diagnosis?
epidural hematoma.
ليش epidural hematoma؟
Because the inner margin is convex.
يعني inner margin is convex أو الشيب كله كده بنسميها باي convex لأنه أصلا ده أكيد convex. بقت باي لأنه الأذر region برضه inner margin is convex. this epidural قلنا بتكون دايما acute لذلك بتكون hyperdense. طيب هنا قلنا في الساين دي ايش؟ حصل ايش؟ ماسيف افكت اللي هو ماسيف افكت كاركترايز باي وات؟ ميد لاين شيفت يعني لو العظم عملنا خط هنا بتبدا ميد لاين شيفت ويز يو نو compression of the lateral ventricle دي بيسموها ماسيف افكت. طيب what is the diagnosis؟
acute subdural hemorrhage.
subdural. ليش subdural؟ acute or chronic or subacute؟
Acute.
اي acute blood بيكون هايبردنس ابيض هايبردنس. فدي السب acute subdural hematoma او هيموريج. ليش قلنا subdural؟ طيب ليش ما epidural؟
concave.
Concave inner margin.
yes inner margin is concave اللي هي eccentric in shape لكن دي شنو؟ lenticular in shape تشبه العدد. this is a what is the diagnosis؟
chronic subdural hemorrhage.
chronic. ليش chronic؟ لأنه appear high dense
Hypodense.
ولكن still عندها شنو؟ concave inner margin concave inner margin. and what is
bilateral acute and chronic.
this bilateral acute
Subdural.
يعني عندنا two density دي chronic and this is acute and this is chronic and this is acute and both have a as you know features of concavity of inner margin acute and chronic. what is the diagnosis؟ برضه دي من الامرجنسي مهمه لذلك انا برضه بحبها دايما ومشكله لانه انا بحب الحاجه الامرجنسي الناس تكون عارفينها كويس. what is the diagnosis؟
subarachnoid hemorrhage.
سباركنويد. لو عايز سباركنويد ليش سباركنويد؟ ليش هاي سباركنويد؟ how do you know ان this is سباركنويد؟ طيب إذا رجعنا لأي سي تي تلقى النورمال صلصاي and سيستير
Because of the CSF.
CSF بيبقى ايش؟ in the سباركنويد بتبقى
hyperdense.
Hyperdense.
this is the blood circulating in the subarachnoid space. يكون في لذلك بيظهر لك زي شنو؟ and the cistern and sulci and Sylvian fissure like this. فthis is a شنو blood اللي هو appearance of high density in this area, the basal cistern or the sulci or the Sylvian fissure. But this is a subarachnoid hemorrhage. Where is the hemorrhage here?
the intraventricular.
Interventricular. What is this ventricle? تكلمنا عنه قبل شوي.
lateral.
إذا اللاترال اللي هو شنو؟ left and anterior or frontal horn. And what is
Anterior
this?
horn.
Yes, and what is this?
third ventricle.
Third ventricle. And these are
Temporal part of the lateral ventricle.
posterior horn or occipital horn.
Or posterior horn. Okay.
Occipital or posterior horn, right and left of lateral ventricle, posterior or occipital horn. What is the diagnosis? طيب إذا ما الدياجنوز هل شايفين ايش اي شيء what is the striking abnormality؟ اكثر حاجه مبينه معاكم شنو؟ يعني what abnormality do you see؟ يعني أي abnormality do you see in this CT؟ اللي شيء الما طبيعي إيش؟
there is
concave.
Yes.
Lifting.
Left إيش؟
deviation of the
Yes.
ventricles
Yes. The left.
because there is a bleeding which appears evident.
Yes. So thank you. This is the right ventricle is compressed and deviated to the right side, to the left side. The left ventricle and this is the right ventricle compressed and there is a شنو midline shift. يعني المفروض الرايت ventricle ده normal يكون the right side لكن حصل shifting of midline structure and compression. دي قلنا ده بيسموها massive effect. يعني كأنه فيش حاجة عاملة لنا ضغط كتلة ولا حاجة عاملة لنا massive effect. But there is a lesion here but still not apparent, not visualized because there this it has a density of similar normal, you know.
Evident.
This is isodense lesion. So what is the type of this hemorrhage or hematoma?
Subacute.
This is subacute. طيب عشان نعرفها هي to confirm this finding نعمل ايش؟ What other technique or other examination to confirm your diagnosis in this is subacute?
MRI.
نعمل MRI. So this is MRI. Which sequence this one?
T1.
اللي هو
T1.
الهيموريج appear as you know
appears hyper intense.
hyper intense. لاحظ انه عنده concave inner margin. So this is the you know. إذا what is the diagnosis?
Subdural hematoma. Because it is concave.
Yes. Acute or chronic or subacute?
Subacute.
Subacute. إذا عملنا MRI T2 زي ما قلنا أيضا حتطلع hyper intense.
Hyper intense.
Yes.
In both.
طيب what is this? What is the type of hemorrhage? Is this one?
Intracerebral hemorrhage.
Intracerebral لأن الهيموريج لا موجود في الإكسترا أكزيال لا موجود in the ventricles لا موجود in the subarachnoid موجود in the brain parenchyma. So this is intracerebral hemorrhage. And what is this? Yes. What is the diagnosis?
Infarction.
Infarction. طيب الفرق بين الانفاكشن والكرونيك سبديورال انه طبعا السبديورال بتكون الانر مارجن بتكون كونكيف لانه البوث ار هايبودنس لكن دي ما بتكون كونكيف. بعدين دي follow الفاسكولار تيريتوري يعني تكون at the area of the blood vessel distributed at the area of the blood vessel لانه الانفاكشن دائما بيكون هايبودنس دائما بيكون بلاك هايبودنس. but this is the infarction or ischemia. Like what sign is demonstrated in this image? ايش الساين دي؟ الساين دي مهمة جدا في الامرجنسي يعني ممكن البيشنت بس نشوف عنده الساين دي. طيب what is this? Is it normal?
This is middle cerebral artery.
Yes, middle
cerebral artery.
Cerebral artery. It appears, you know,
hyper dense.
Yes, it appears dense. Is it normal to appear like this in non-contrast CT?
Abnormal.
Abnormal. So this is called dense.
Dense artery sign.
Yes, there's artery sign. What is dense? What is this sign indicate? What? تلقين الساين دي مع
Thrombus.
in يعني أيوة. So there is thrombus. So this is the early sign of what?
Infarction.
Infarction.
Yes, this is the early sign of infarction. يعني معناته البيشنت ده شوية كده هيحصل له شنو؟ well organized infarction. This is the early sign. What is this?
This is basilar artery.
Basilar.
Appears hyperdense.
So appear hyperdense. This is a dense basilar artery. طيب السلايد دي بدأنا نتكلم عن الإيديما. This is called what؟ دايما حوالين الليجن يعني دايما غالبا يكون عندنا إيديما. طبعا إيديما لأنه فلويد بيكون هايبودنس. This type of إيديما بيسموها شنو؟ Vasogenic. طيب بنعرفها كيف vasogenic؟ بتكون
finger shaped appearance.
Yes, عندها finger like appearance اللي هي involving only the white matter. لكن الجري ماتر ما بتكون involved. بعد الجري ماتر هنا spare. جري ماتر لذلك بتصحى كأنها finger. لأنه with sparing of شنو؟ جري ماتر involving only the white matter. So this is a vasogenic brain edema. And also this is a vasogenic. الليجن هي هذه الليجن. هي دي الليجن. This is a tumor مثلا. Around the tumor there is an edema. So this is the vasogenic brain edema, finger-like, involving the white matter only, with the sparing of the gray matter. But in the around the blood or يعني ischemia إذا عندنا hemorrhage or عندنا ischemia برضه عندنا around this blood or the faction also there is edema اللي هي دي لكن بتسموها شنو؟
Cytotoxic.
Yes, yes, cytotoxic brain edema. Cytotoxic brain edema. So cytotoxic edema occurs around the hemorrhage and infarction, but the vasogenic edema surrounding the space occupying lesion, abscess, tumor, finger-like, involving the white matter. Like this can involve both white and gray matter. White and gray matter. This is the last lecture. Like what is this imaging technique?
Scintigraphy.
This is scintigraphy for which structure يعني for the
Thyroid.
Thyroid. This is thyroid scintigraphy. Thyroid scintigraphy. طيب what abnormality do you see? يعني in the circle, within the circle. compare between the normal. هنا المنطقة دي بنسميها ايش؟ حصل ايش؟ This is the right lobe and this is the left lobe. هنا المنطقة دي معناتها في ايش؟
Nodule.
ايوه نديول لكن بيسميه ايش؟ which type of nodule؟
Cold nodule.
Cold nodule. ليش سمينا cold nodule؟ right there is a cold nodule. ليش cold nodule؟ لأنه there is a decrease decrease radio tracer uptake. يعني هنا المنطقة دي ما حصل uptake to the radio tracer. هنا normal. لاحظ المنطقة هنا normal للثايرويد tissue uptake the radio tracer. لكن المنطقة دي there is no or reduce or absent uptake of the radio tracer. سموها cold nodule. In contrast, لاحظ إنه this is the left lobe and this is the right lobe. هنا there is a distribution of the radio tracer evenly. يعني with symmetrical distributed in all parts. لكن in this area there is ايش هنا؟
increase
uptake. لذلك النوديول دي بنسميها ايش؟ hot nodule. This is a hot nodule لأنه there is increased uptake. And this is a cold nodule because there is a decreased uptake. طبعا لازم تعرفوا دي في اللي هو انه cold nodule دي بنخاف منها لانه هي raising the possibility of malignancy. لكن اهم شيء ممكن اجيب لكم واحده من دي نقول لكم اول التكنيك تقول thyroid scintigraphy. The abnormality ممكن تقول cold nodule with decreased radio tracer uptake or hot nodule with increased radio tracer uptake or radioisotope uptake. This one. This is a CT or the orbit. This is a thyroid eye disease. لاحظ انه there is bulk يعني enlargement of the medial rectus muscle. Medial rectus muscle are enlarged or bulky, and this is also optic nerve is bulky. فthis is a thyroid eye disease. لاحظ إنه حصل شنو ذاك protrusion of the شنو of the orbit. فthis is a thyroid eye disease. CT thyroid eye disease إذا قلنا mention one abnormality ممكن تقول bulkiness or enlarged دي شنو enlargement of the شنو rectus muscle, medial rectus muscle, medial rectus muscle. So this is CT at the level of the thyroid. CT with contrast at the level of thyroid. This is trachea. طبعا عارفين الثايرويد hugging the trachea. But this there is a multiple nodule. عرفنا وين multiple nodule. الصغار دي كلهم nodule multiple nodule. But this is a شنو multinodular goiter. multinodular goiter. multinodular goiter. هي خلوها كده. Do you have any question? If you have any question,
يعطيك العافية دكتور.
إن شاء الله.
دكتور الآن حنسأل كمان عن الإكزامينيشن وحتحط لنا أرو على الأماكن.
هحط لكم إيش؟
أسهم على الأماكن وتقول لنا مثلا هذا إيش.
على حسب اللي أنا سألتكم منه دي، بس بيكون بنفس الطريقة اللي سألتكم بها دي. يعني